Good morning. This week we start our discussion on hypertensive disorders in pregnancy. Pregnancy should be a joyful period for the mother, but one of the major threats of pregnancy is high blood pressure in pregnancy. So this week I'll do a number of videos on everything you need to know about hypertensive disorders of pregnancy. Today we will discuss what is the normal blood pressure in pregnancy, what is elevated blood pressure, what is dangerously high blood pressure, and how we classify hypertensive disorders in pregnancy. So what is normal blood pressure in pregnancy? Normal pressure in pregnancy should be less than 120/80. Sometimes the pressures can fluctuate during pregnancy, but you want your pressures to be below 120/80. If your pressure is more than 140/90 on repeated episodes, that is hypertension. So hypertension in pregnancy is pressure above 140/90 on repeated episodes. And if your pressure is over 160/110, that is dangerously high pressure, and you need to seek medical attention immediately. And this most times will require admission. So normal pressure is less than 120/80. Hypertension is pressure above 140/90 on repeated episodes. And if your pressure is above 160/110 in pregnancy, that is danger. You need to act fast, rush to the nearest hospital, and this may require admission. So how do we classify hypertensive disorders in pregnancy? We have 4 different types, and it is important to note them because they require different management and each carries its own risk. Number 1 is gestational hypertension. This is hypertension that occurs 20 weeks and later. Elevated blood pressure of above 140/90, more than 20 weeks of pregnancy. And it is not associated with any damage to the organs, gestational hypertension. From gestational hypertension, we have preeclampsia. Preeclampsia is high pressure, elevated pressure that occurs more than 20 weeks of pregnancy, associated with damage to the vital organs. What damage do we talk about? We test your urine and we get protein on urine. If your pressure is elevated and there is protein in urine, that is preeclampsia. It can also affect other organs like the liver, the kidney, and the brain. And the preeclampsia is a severe form of hypertensive disorders in pregnancy. From preeclampsia, you go to the most dangerous form, which is eclampsia. Eclampsia is a patient with preeclampsia develops convulsions. So severe headache, blurring of vision, convulsions is very dangerous. We call that eclampsia, and that requires immediate delivery to save the life of the mother and the baby. And the 4th type is chronic hypertension. This is high blood pressure in pregnancy that occurs less than 20 weeks of pregnancy. So if you are diagnosed with high blood pressure in pregnancy at week 14, that is chronic hypertension. That may mean you had high blood pressure which was missed, and this type may require someone to be on lifelong medication. So that is our talk for today. Today we have learned what is the normal pressure in pregnancy, which is less than 120/80. Hypertension in pregnancy, which is pressure over 140/90. And the 4 types of hypertensive disorders in pregnancy. Chronic hypertension, you are diagnosed with high pressure less than 20 weeks of pregnancy. Gestational hypertension, which is hypertension that occurs after 20 weeks of pregnancy with no damage to the organs. Preeclampsia, which is high blood pressure plus organ damage, protein in urine, kidney damage, liver damage, damage to the brain. And the most severe form, which is eclampsia, which is convulsions in a patient with high blood pressure. But remember, in all this, we want to be more empowered so that we can have early diagnosis early treatment and save both the life of the mother and the father. So stay tuned. Tomorrow I will discuss the danger signs of hypertensive disorders in pregnancy, which you should not ignore. Dr. Beatrice Muthui-Mutua, consultant physician cardiologist, saving lives one heart at a time.